I'm Monica Kaniganti. I'm a rising senior at the University of Pennsylvania studying public health and pre-med. As a Philadelphian for the past 10 years, I really wanted to branch out this summer, and I'm glad that I came to Boston through HCC. During my freshman year at Penn, I got involved in health economics research and looked at broad health policy implications. Then I got the chance to do some on-the-ground public health work, and I also got interested in community health outreach and healthcare delivery systems. I came into college knowing that I wanted to do medicine, but I really like big picture thinking and looking at system-level issues in healthcare. My placement at the Brigham and Women's Faulkner Hospital this summer allowed me to bridge my interest in medicine and healthcare management through a hospital administration internship. I worked under the Director of Strategy and Clinical Program Development and interfaced with several hospital leaders and physicians with dual degrees, MBA or MPH, to see how they're applying other skills and interests with medicine. While some recommended that I get an MPH and others an MBA, I realized that my interests fell in both areas and that both degrees can come with versatile opportunities, especially in academic medical centers. Before I rush into any program, I will focus on acquiring skills I need for improving healthcare delivery in hospital and community settings. My first major project this summer was forecasting the value of moving the kyphoplasty procedure, which treats spinal fractures by stabilizing bone and restoring vertebral height loss using a balloon tip, from the OR to the pain management center. I met with several stakeholders to understand risks and necessary changes to workflow in the pain management center. Finally, I presented a risk-benefit analysis to lead a discussion about next steps with several stakeholders. I've gained an understanding of diverse components of establishing a procedure in a hospital outpatient setting, taking into account staffing requirements, varying reimbursements, and more. The second project I worked on involved poor patient discharge instructions from outpatient surgery, which was a patient safety issue. I presented the current state of the after-visit summary at OR Exec and OR Committee to discuss different options for improving the situation. This project has a direct impact on the lives of people in the community in that it gives all patients equal and appropriate access to care instructions and how to follow up with their doctor. Patient education is a vital component of hospital care. I worked on 3 different projects, all relating to workflow and metrics in different areas of the hospital. For one project, I was introduced to the concepts of quality and process improvement to decrease the time between when a bed is requested in the ED to when a patient is transferred to an inpatient floor. It was interesting to see how people give varying feedback for a particular issue and how quantitative data allowed us to identify whose story was more accurate. Overall, I expanded my knowledge and interest in hospital administration and quality improvement. I learned about population health management, new payment models, and how metrics can drive more effective patient care. I understand that there are always many things to improve and improve in multiple ways. I am glad that I was able to offer my insights and experience with data collection and presentation. I know there are many ways I can apply the skills I developed from this summer and integrate my interest in healthcare management with my medical career. Thank you to Linda, Katie, Jeff, and HCC for an amazing experience and your continuing support.